So my name is Greer. As she says, I am a dietitian. I've been working with children with autism spectrum disorder, ADHD, PDD-NOS for the past couple years, and really trying to narrow down those underlying causes of what could be really impacting their life and their nutritional status. So autism spectrum disorder refers to a really broad range of conditions. So not everybody's going to be the same. Diagnoses of girls and boys are very different. The criteria are separate. Girls are usually misdiagnosed or diagnosed later in life, but boys are right now 1 in 32 and girls are 1 in 144. And the rate continues. Every year it keeps going, getting smaller and smaller. The signs of autism can start as early as 2 or 3. It can be diagnosed as early as 18 months. They do have really strict guidelines for autism. It's usually the issues with social skills, repetitive behaviors, speech, and nonverbal communication. But that's mostly in boys. Girls are very different. Girls usually are typically the opposite. So autism can also incorporate OCD and sensory processing disorder, which are both different types of behaviors that can come along with autism, and it also can exacerbate it. But autism is also based on 3 components. There is a genetic component, there is a metabolic component, and then there's an environmental component. So autism is not just a genetic abnormality. There are other abnormalities, and we don't always know the underlying cause unless we start doing testing. Next slide, please. Typically, every patient that I see with autism has some type of feeding disorder. Either it's selective or very restrictive eating. So anywhere between 60 to 89% of children are selective eaters. So they don't like certain foods, they don't like certain textures and tastes. Certain things need to be crunchy, certain things need to be soft. So it really depends on your child. It's not cut and dry, and every child is going to be very unique and very, very different. So when I usually see a child, we have to go through a whole entire intake and find out what their diet is, what they're eating, because they usually don't like to expand. So about 89% of reports of children are unable to even sit for family meals. Either they have, the OCD, the ADHD, they can't sit, they can't, being around other people. And 56% eliminate previously eaten food from their diet. So even if you sit down for family dinners and you try to change things up, kids could say they eat chicken every day for a couple of days, and then all of a sudden they won't eat chicken at all and refuse it. So it's really hard sometimes to keep up with the picky eating and the selective eating. So I do a lot of work with people in picky eating and trying to make your child feel a little bit more comfortable with sitting at the table, trying new foods or trying previous foods, and just continuing the process. So the issue is, even with kids that are selective or restrictive eating, children with autism generally still achieve the normal height and weight of neurotypical children. So a lot of pediatricians miss the fact that your child could be deficient in certain nutrients because they're hitting their milestones, they're hitting the charts, and it doesn't look like they're malnourished. It doesn't look like they're losing weight. So they don't really know. So they're eating, but they're usually eating only specific foods, certain types of foods, and they're usually not the most nutritious foods. So that's what leads to nutritional deficiencies, and we don't usually see it until we actually test for it. Next slide, please. So I do micronutrient testing, and there's a lot of testing that usually goes along with autism spectrum disorder. And it's always a good thing that if you have a child that's a picky eating or selective feeder, to find out what supplements that they might possibly need, because every child's different. So this is all science-based. This is all nutritional deficiencies and low levels that have been recorded in children with autism and ADHD. So you'll see, your B12s, vitamin D, vitamin E, folate, biotin, pantothenic acid, calcium, And then you'll see a lot of times low levels of magnesium, selenium, chromium, iodine, lithium, choline, fatty acid imbalances. And we know malnutrition deficiencies can result in like scurvy, vision loss, and iron deficiencies, but it doesn't mean that these other types of nutritional deficiencies won't impact the body. It could be from, disrupting sleep, excessive behaviors, violent behaviors, all could actually be an underlying cause of nutrition deficiency, and we just don't know. It doesn't also mean that they're not nutritionally like feeding, getting all their nutrition from food. It also could be a stomach issue where they're not actually able to absorb any of these nutrients that they're eating because of GI issues. So it goes twofold, where it could be related to food, but it also could be related to the gut. A lot of the times when you see a practitioner, if you have a child with autism, you have to look at the child as a whole, and you have to look at what they're eating, the nutritional aspect of it, and also what's possibly going on in their GI tract. Next slide.
What is the trigger point? What is the trigger point that a parent can think like, oh, my child is autism? What would be that?
So typically, one of the biggest things I notice with children is they have a very extended stomach. That could be bowel issues. So if your child has a very extended stomach, it could be GI issues. If your child is prone to constipation or diarrhea, that's usually a number one thing where I want to correct what's going on in the gut. And that sometimes can be why you're not absorbing the nutrition aspect of the foods that you're eating. Other things are making sure that your child is eating a variety of types of foods. And if we can't get there first, we have to try to find supplements that work best for the family and for the child. So we start low. There's a ton of supplements out there that you can hide in food and, hide in their waters and things like that, or juices. So it's every child is so individualized. I wish I could give you just like such an easy answer, but every child, I have to customize their nutrition panel, their supplements, their regimen, so specific to them. So, nutritional deficiencies could be associated with functional issues, behavior impairment, communication problems. I've seen kids start taking specific supplements that they needed because they were low, and all of a sudden either certain behaviors stopped, they were able to communicate better, function, sleep better. So micronutrient testing is an amazing thing. It's easy, and it's something that can be done at home with certain practitioners like myself, and to try to pinpoint exactly what your child needs. And that's the most important thing, because we know any type of nutrition deficiency can impact the brain. And making sure that the kids start out early on with the right track, and making sure that they, usually you'll see children be more picky between the ages of 2 and 3. And that's for neurotypical children, just because it's a control thing. But children with autism and ADHD, their picky eating goes usually around 1 to 2, and it continues. So that's where it's a problem. And that's where we need to address it as early as we possibly can, because we don't want to wait till they're older and they're still having issues, either trialing foods, food textures, food issues with it gets really hard when they get old.